right, so my name's Heather. I'm going to do your assessment today. I'm going to ask you some simple questions, so you do some different commands, and you just got to follow along. If you have any questions, let me know.
Okay.
All right. This is my male patient today. He's 47. He's Caucasian. He makes solid eye contact when we're talking, and he should be able to follow commands. So first, we're going to inspect your abdominal cavity. So if you come lay down for me. So I'm going to inspect his abdomen. All right, we're going to look for color symmetry. Umbilicus is midline. I don't see any lesions or any scars or any signs of trauma or previous surgeries. And we're going to listen to your valves and make sure everything is functioning properly there. So you would start in the lower right quadrant, and you would listen each quadrant for 2 to 5 minutes just to make sure you hear the vowel sounds. You're listening for hyper, hypo, or no active vowels. I can hear a lot of movement so far. And then I'm going to listen to your aorta and listen for any bruits or any murmurs. I'm going to listen to the iliac. And then we're going to listen to the renals next. All right, everything sounds good there. Now we're going to percuss all the quadrants. So we're going to do some tapping, and we're going to hear tympani over most of the regions here. Anything else could indicate some sort of blockage. Around the umbilicus, we're going to have hyperresonance. All right, then we're going to percuss your liver. So we're going to feel over here in the costal region, and we're going to listen for when our sound changes. All right, so we got right here, a little mark, and then we're going to come up above. All right, and then we're going to measure. It should be 6 to 12, and you are good. And then we're going to do your spleen on the other side. So the spleen should not be more than 1 to 2 centimeters past the rib cage. Otherwise, that would be splenomegaly, and that feels good there. Let me just make sure. Yep, here too. All right, now we're going to do some palpation around. We're feeling for any tenderness, any signs of pain. Does anything hurt?
No.
And then we're going to do like a little bit deeper palpation, really trying to feel the organs and the outlines of the organs. And we do the whole entire stomach, about 5 to 8 centimeters deep. Okay, and then we're going to palpate the aorta. Okay, this on the side. All right, and the aorta should be about 2 to 3. Yep, perfect. All right, and then we're going to palpate the liver border. So if you can do deep breath, thank you. All right, the liver is good. Breathe for a second. And then we're going to do the spleen on the other side. Deep breath. Awesome, thank you. Now we're going to work on the kidneys. So I'm going to get my hand under behind your back here. All right, and I'm going to, oh, there it is right there. All right, we're going to do the left kidney. All right, all looks good. And now you can sit up. We're going to start doing your upper extremities. All right, how you doing, Doctor?
All right.
All right, we're going to check the clavicles. We're going to make sure everything's nice, even. The shoulders are even. No wasting with the deltoids. We're going to start checking your different joints. So we're going to do your sternoclavicular. We're going to work our way down over to the acromioclavicular. We're going to do your spine, and then we're going to do the tubercle of the humerus and work our way down here. Any pain or anything? All feel good?
All good.
All right. So you repeat this on the other side, but for time's sake, we're going to do just one side today. So we're going to check your range of motion. You can put your arms cross above your head. Come back down and cross in front. All right. Put your arms out and up and over your head as far back. Bring them back down, back behind you. Awesome. Can you make fists? All right. And I want you to put arms out. All right. Don't let me push down, okay? Don't let me push up. All right. Back to the fist. We'll do the same thing. Don't let me push down. And don't let me push up. Perfect. All right. All right, and I'm going to do your neck. So if you put your neck to one side, the other side, look back, and look all the way down. Perfect. Full range of motion of the neck. Now we're going to check some of your reflexes. We're going to do your bicep first. There we go. So for the bicep, we'll do right here, relax your arm. Awesome. That's good. We're going to come down here, and we're going to do grip your ribs. Okay. And then each put your arm out. And do the tricep back in here. Awesome. And you repeat again on the other side. But once again, for time purposes, we're going to skip. And we're going to palpate your pulses. So I can do both at the same time. So we do the brachial pulses. And then do your radial pulses. Nice and strong. All right. Now we're going to test your wrist strength in your hands. So put your hands right out. I'm going to check to make sure that they are symmetrical. There's no swelling, nothing like that. We're going to check and palpate everything. Make sure I don't feel any nodes, anything else that's going on. I'm going to do each individual finger. All right. And we do both hands. All right. Now I want you to do range of motion. Put your hands out. Flex up, down, roll in, and roll out. All right. Our upper extremity is all good. Now we gotta do your hips, so I need you to stand up for that. We're gonna check the ACEs, so we're gonna feel the spine on the front of the pelvis. And we're even. If you can turn around, face the other way. We're gonna do the PSIS in the back. So we're gonna check again. All right. There we go. And then we're going to do some range of motion. So, you can kick or step and hold one leg out to the side. There you go. Switch to the other side. Awesome. And then we're going to probably have you spin so you can have more room. Put one leg out in front of you. Down, back behind you. Switch legs. Front, behind. And then if you can cross your leg over. And the other side. Perfect. And your hips are done. All right, you can sit back down again. We're going to do your lower extremities. So we're going to check out your knee. Having any problems with your knees?
Nope.
All right, we're going to palpate the top. Around the knee to the bottom. We're going to do lateral. Any pain? Nope. We're going to do behind. All right. So you can flex your legs out, flex your legs in. I want you to push against me. All right, don't let me pull down. Perfect. So you palpate both knees, but again, for time purposes, we're focusing on just one leg at a time. Then we're going to work our way down, and we're going to do your feet and your ankles. So we're going to palpate all down here. I don't see any swelling. Any tenderness anywhere?
Nope.
Do each individual toe, around the ankle. All good. All right, next we're going to do, all right, up. We're going to do range of motion in your feet. So you can flex your feet up, down, point your toes, rotate in, and then rotate it. Perfect. Thank you. And then we're going to check your pulses. So we're going to do your Durasalis pedis. Here on the top. Alright, got it. And then we're going to do the posterior tibial. Alright, got it. And now we're going to do your reflexes again. So we tell the reflexes first. My son's laughing in the background. All right. And then we're going to do your Achilles. Awesome. Looks good there. Oh, and then we're going to check your reflexes from the bottom. All right, now we gotta move on to your spine. So again, we have to have to stand up one more time. For now, at least I should say. All right, so we're gonna check out his posture. His shoulders are even. He's not leaning to one side or the other. Hips are balanced. All right, try and settle these right. Same, we've got the proper curvature. All right, so we're gonna check out the spine. Centered, if you can bend over so you can check. Awesome. So everything's pretty straight. Okay, and if you come back up, I'm going to check more range of motion so you can lean back as far as you can go. Perfect. And if you can lean to one side, back up, check the other side. And if you can rotate and look at me without moving your hips. Next, twist your whole upper body. Awesome. And there we go. Perfect. The spine is doing well. All right, you can sit back down again. Now we're going to check your cranial nerves. So we're going to look at cranial nerve 1. It's just your sense of smell. So if you can cover one side of your nostril for me, I'm going to put a item underneath and you're going to let me know what it smells like. Mason, stop! All right.
Vanilla?
Yes. All right, do the other side. Eyes closed. Let me know what this smells like.
Chocolate?
Yes. All right, so sensory 1 is in place, sensory 2 is your visual. So we're going to cover one eye, and we're going to check your peripheral vision first. I'm going to hold up numbers, and you'll let me know what you see, okay?
3, 2, 1, 4.
All right, cover the other eye.
2, 1, 3, 1.
Perfect. Now we're going to check your vision, so if you can cover one of your eyes. And let me know what's the bottom line that you can read.
E-P-T-Z-O.
All right, cover your other. Do it again.
E-P-T-Z-O.
All right, you're 20/30 in both eyes. Pretty good. All right, next we're going to check 3, 4, and 6. All right, so I need you to just follow my finger without moving your head, just your eyes. So we're going to check his 6 cardinal degrees gaze, making sure all the extraocular movements are working perfectly. All right, and then we're going to test your... Mason! Stop! We're going to check your pupil reflex. All right, both pupils react to the light equally. All right, now we're going to move on to cranial nerve number 5. Okay, so I need you to close your eyes, and I'm going to put either a soft or a sharp object on you. I need you to just identify which one it is, okay?
Soft. Sharp. Soft.
All right, good. All right, next I need you to clench your teeth and don't let me open your mouth. Good, nice and strong. Next we're going to do number 7. So still, I'm going to pinch your eyes shut and don't let me open them, or you got to open them against me. All right, good. Now we're going to check the rest of the facial functions. Can you raise your eyebrows? Can you smile? Can you frown? Don't worry, be over soon. All right. Ooh, we're going to do the best part. We're going to try to test sweet and salty on your tongue. All right? So I need you to close your eyes. I'm going to put a substance on your tongue, and you're going to tell me if it's sweet or salty. And you can eat it if you like. It's up to you.
Salty.
Okay. Would you finish that real fast?
Absolutely.
All right, ready? Now the next one.
Salty.
Yeah, so what is that, sweet or salty?
Oh, that's sweet.
Awesome. Thank you. Good?
Mm-hmm.
That's your treat for doing this. Thank you. Alright, now we're going to do cranial nerves number 8. These are for your hearing. So, you can open your eyes. Okay, good. So we're going to test your sensations. I'm going to put this on your forehead. You're going to let me know, do you hear this equally in both ears?
Yes.
Alright, so this is the lever test. We're going to do a ride test on the side. Let me know if you can hear this. This is bone conduction.
Yes.
Alright, so we would time this and we wait to see how long until he would tell me he doesn't hear this anymore. And then once he doesn't hear it, we would move it to the side of his ear. Do you hear this?
Yes.
Alright, and he would tell me how long until he stops hearing that. And this is louder than the other one, right?
Yes. Well,
Okay. So this should last twice as long air conduction compared to bone conduction. And we repeat again on the other side for comparison. Then we're going to move on to the whisper test. So I'm going to whisper a word in your ear and you just repeat, okay? So,
car.
good job. So you again do both sides for comparison. Now we'll do cranial nerves number 9 and 10. We're going to have you open your mouth and you just say, well, actually, let me get my light too so I can see better. You just say, ah. All right, our palate lifts. And I have to do the gag reflex. I'm so sorry. I'm going to touch the back of your throat and we're going to make sure that that's intact, okay? So. You okay?
Yep.
All right.
You almost got covered in chocolate.
And pretzel. All right. And then one more thing. I'm going to have you swallow so you can rinse off that lovely sweet and salty. Make sure everything works well for swallowing. Any difficulties there? Everything good? Awesome. Perfect. Okay. Then we're going to, we're going to do cranial nerve number, everything's falling over here. Cranial nerve number 11. I want you to turn and face this way. I'm going to push against for resistance, but I want you to push back. All right, nice and strong. Same thing on this side, nice and strong. I'm going to push down. I want you to shrug. Awesome. All right, then we got cranial nerve number 12. Can you just stick your tongue out, move side to side, and then if you can push your cheeks out, chest for strength. Perfect. All right, so now we're going to check your rapid alternating movements. I need you to put your hands on your legs and just, there we go. Works well. We are going to do the heel to shin test. So I need you to put your heel up against your one shin and roll all the way down. All right, nice, quick and straight. We're going to the other side. Same thing, all the way down. Good. Then we are going to work on your pain and temperature. So I'm going to put a hot substance and a cold substance against your arms while your eyes are closed. You're going to tell me if it's hot or cold, okay? So first, eyes closed. Okay, good.
Hot.
Okay.
Cold.
Awesome. Now we're going to do some pain. I'll try not to make it too hard. You're going to tell me if this is sharp or dull.
Sharp. Dull. Sharp. Dull.
Awesome. All right. Okay, eyes still closed. I'm going to move your fingers and your toes up and down. I just need you to tell me which direction am I moving, okay?
Mm-hmm. Up. Down. Up. Up.
Good job. Okay. Next we are going to do... Oh, we're going to do the tuning forks. So we're going to make sure you can feel the conduction to your bones again. I'm going to do on each of your fingers and each of your toes. So if you can close your eyes. Hands down. There we go. Let me know you can feel this.
Yes.
How about on this side?
Yes.
Alright, we're going to go for your toes.
Yes.
And your other toe.
Yes.
Awesome. Alright, so there's that. Now we're going to check for your cernosis. So I'm going to put an object in your hands. You're going to tell me what it is. So if I can have your palm, eyes closed still. Tell me what that is.
Quarter.
So, alright, how about try this hand?
A ring.
Yes, good job. Now I'm going to draw letters in your hands. Still dry and closed. And let me know what the letters are.
H.
Okay.
A.
Everything's intact there and normal. All right. Now, I want you to tell me, am I touching in one spot or two spots?
2. 1. 1, 2.
Perfect. Now we're going to test your proximity of touch. Let me know if you feel 2 different locations or 1.
2, 2, 2, 1.
Very good. All right, and now last part of our test. I need you to stand up. Pick up all the stuff that decided to randomly fall. All right, and you can walk straight across the room. And then walk backwards back. We'll walk on your toes. And walk on your heels. Awesome. Can you step to the right? And step to the left. Hit them all. Let me see. That's your gait is good, your balance is good. Yep, all good there. All right, so now can you stand with your feet together? Checking for any swaying, and can you close your eyes with your feet together? Beautiful. All right, open your eyes again. Arms straight out, and now close your eyes. And we don't have any pronation drift going on. All right, you're all good to go. Thank you so much.